Thank you for the opportunity to speak today. I'm going to talk about the health literacy response framework, the grounded identification of strategies for providers and organisations. I'll start by touching on health literacy and what we mean by that, and then I'll go on to introduce you to the health literacy response framework and its development. Health literacy is not a new term, but historically it has been thought about in terms of literacy relating to engagement with written health information and also numeracy, things like being able to calculate medication doses and so on. But over the last, particularly 5 to 10 years, people have been thinking about health literacy in much broader terms, and we now think about it as a concept that brings together a whole range of concepts that relate to what people and communities need to make effective decisions about health for themselves, their families and communities. So we define health literacy as the personal characteristics and social resources, so the skills, the knowledge, the motivation, beliefs, confidence, resources and supports that people need to access, understand, appraise and use health information and services to make decisions about their health, but also the health of their family and community. There is now substantial evidence linking poor health literacy with a range of health-related outcomes and increased healthcare costs. And we see this association across all continents and across all countries at all stages of development. When we think about this link between health literacy and health outcomes, we need to consider not only the skills and capacities of people and community members, but also the role of health services. So when we think about health literacy, we need in parallel to think about health literacy responsiveness. We define health literacy responsiveness as the way that services make information, resources, supports and environments available and accessible to people with varying health literacy strengths and limitations. When a health system is structured such that it makes services and information very available and accessible to people, people require much lower levels of health literacy to be able to engage with those services and information such that they can make informed decisions. When services are inaccessible or available and accessible only to certain groups within the community, often the requirements around health literacy for community members is much, much higher. So it is this interaction between the health literacy responsiveness of services and the health literacy of the people that are making and supporting health-related decisions that influences the decisions that are made. So we need to address health literacy issues not only by improving health literacy, but also improving the responsiveness of systems to the health literacy issues that exist within communities. If we're able to do this, we do have a chance to improve health outcomes and reduce inequities. By enhancing people's access to and engagement with health information and services, we can improve the opportunity that is available to people to make effective decisions and their ability to do so, and the quality potentially of those decisions. And if we're able to achieve that, we can enhance people's engagement with healthy behaviours as well as disease screening, treatment and management. So it's increasingly being understood that we need to do something about health literacy if we want to address health outcomes and improve equity for people. Health literacy is now embedded in many, many policies across the world, but what we often see is some engagement and readiness of organisations and governments to do something about this issue, but there is confusion about how to go about addressing this issue. So we've sought to develop what we call the health literacy response framework to assist and guide organisations and governments to identify potential solutions to the issues that they see within their communities. So the Health Literacy Response Framework is one key output of the Ophelia Victoria study. There are several Ophelia projects that are being conducted across the world, but the Ophelia Victoria study is a large study across 9 healthcare organisations in the state of Victoria in Australia. All of the Ophelia projects aim to improve health outcomes and reduce inequities by empowering health and community services and their providers to optimise health literacy of their clients and communities, but also improve their responsiveness to clients with varying health literacy strengths and needs. The Ophelia Victoria study has been funded by the Australian Research Council via ARC linkage grant, as well as by Deakin University, Monash University and the Victorian Department of Health. I don't have time to go into the methodology behind that project today, but you can read the study protocol and the paper's accessible from the Biomed website. The Health Literacy Response Framework is a conceptual framework that makes explicit health literacy intervention components and the associated requirements of health providers and systems. Not only does it guide organisations to select and plan health literacy responses, but it also provides a scaffold for an evolving repository of intervention ideas, tools, guidelines and resources that can be shared amongst Ophelia member organisations around the world via. Let me go on to discuss the development of the Health Literacy Response Framework. As I mentioned, the Ophelia Victoria study was conducted across 9 organisations in Victoria, and we had 77 workers, so health service managers, practitioners, community workers participate in a range of activities. They began by collecting health literacy data from members of their community. So we had 813 community members participate in a needs assessment process. We synthesised the data that emerged from that needs assessment and presented that data back to the staff members in a series of workshops. And we discussed what was observed from the data, and we asked them to generate ideas. Tell us what is being done or could be done to improve the health literacy and the outcomes for the people within the community that they identified as being a particular need. With those intervention ideas, and we had several hundred that were generated over through that process, we thematically analysed those intervention ideas and then matched those intervention ideas back to health literacy needs. We then undertook a series of workshops where we examined each of those intervention themes and identified mechanisms by which those interventions could influence health literacy and improve outcomes. And then we also looked at each of those intervention ideas and identified the provider, organisational and higher order requirements associated with the implementation of those interventions. And the result is a framework which consists of a broad range of consumer level responses and a set of practitioner level, organisational level and regional level prerequisites. The consumer level responses were about supporting and building the capacity of clients directly, and the practitioner level prerequisites focused on supporting and building the capacity of staff. The organisational level prerequisites focused on improving the accessibility of services and health messages, and the regional level prerequisites focused on improving the availability of services and the connection and integration of services across the region. I don't have time to go through each of these consumer level response themes in detail, but they range from focusing on building trust and responding to consumers in a person-centred, coordinated way, to supporting service navigation and the development of capacity to independently navigate services, to providing reliable, tailored information in a graded manner, and checking and ensuring understanding. As I mentioned, there were several hundred intervention ideas that were generated through this process, and as part of the Ophelia Victoria study, our participating organisations have selected several of these to design, build up resources for, implement and test. And just to give you an idea of an intervention, the sort of thing that we're talking about, this is a learning needs assessment that one of our organisations have now built into their usual process of screening and assessing new patients. So it's designed to prompt and support a conversation between a health worker and a new patient around what their learning needs are, the sorts of ways that they would prefer information to be provided to them, so that moving forward through the educational process and case management or support process, that the health providers and the rest of the team can keep in mind exactly what the preferences and needs of that patient are in relation to learning. To give you a sense of the practitioner, organisational and regional level prerequisites, at the regional level, integration of services was seen as critical. At the organisational level, effective marketing of services, having an appropriate mix of services, having a high level of service accessibility, and having effective partnerships with local services were seen as prerequisites for effective implementation of consumer level interventions. At the practitioner level, in order that these consumer level interventions could effectively be implemented and engage consumers, our workers identified that effective professional development was critical, and that came up repeatedly. As well as that, they felt they needed effective professional networks to support referrals and to support understanding themselves what the health system could offer their patients and consumers. Practice guidelines was another key prerequisite. Having effective management and mentoring they felt was really important for them. And then having the tools, aids and resources that they need to effectively perform their job so that they can offer information and support to consumers in a way that was tailored to their needs. When we discuss this health literacy response framework or the outcomes of our consultation activities, we often get asked the question, what is not a health literacy intervention? It seems as though everything that you could potentially think about has some impact on health literacy or could be considered a health literacy intervention. And I think we would probably agree with that. Our evolving understanding of health literacy and the mechanisms by which it influences health behaviours and health outcomes suggests that, by and large, all the healthcare and health promotion services, products and programs that we design and implement and try to engage patients with or consumers with should act to enhance their health literacy to some extent, and should act to support health literacy challenges that are experienced by people. Whenever we are trying to engage people in making decisions or changing health behaviours, we need to consider how effectively those responses interplay with somebody's health literacy. So the framework provides some insights into the conditions that are required to optimise consumer health literacy and engagement in health actions and care. So I think that it's actually more useful to ask the question, how health literacy responsive are your programs, are your products, are your services, and how effectively do they build health literacy? The next steps for us are to confirm and validate the framework, and we also need to consider how we might develop tools, resources to support providers, organisations and governments to assess how responsive they are, how responsive their services, environments and products are, and support them to walk through the steps of co-creating, implementing and evaluating programs that are health literacy responsive and that do act effectively where possible to build health literacy in consumers and in communities. We have a website. You're welcome to find more information at the Ophelia website, ophelia.net.au. We will be publishing later in the year an Ophelia toolkit, which will be a step-by-step guide for identifying and responding to health literacy needs within local communities. We've launched at this conference the Health Literacy Toolkit for low and middle income countries, which we've co-developed with the WHO Regional Office for Southeast Asia. And thank you for having me. You can contact me at either ophelia.net.au or via my email address if you have further questions.